All right, welcome back everyone. I'm delighted to present our next panel session titled Towards a New Global Public Health Convention. This session is hosted by our longstanding supporters and partners of Unite, the AIDS Healthcare Foundation, who will present this exciting initiative achieved through research developed at the AHF Global Public Health Institute at the University of Miami. Moderating today's panel session are Drs. 𝗪𝗓𝗪 and 𝗨𝗪𝗪𝗪𝗪𝗪𝗪𝗪. I will first introduce Dr. 𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪, who is the Executive Director of the AHF Global Health Institute at the University of Miami in Florida. Prior to this position, he served as AHF's Global AIDS Ambassador. And before joining AHF, Dr. 𝗪𝗪𝗪𝗪𝗪𝗪𝗪 was engaged in HIV and AIDS work in Mexico, where he founded the first ambulatory care AIDS clinic in Mexico City. 2 years later, he was appointed Director of SENSIDA, a government agency that works to prevent HIV transmission and reduce the impact of AIDS. Dr. 𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪 additionally serves as the Vice Chair of the IAPAC Board of Trustees. Co-moderating with Dr. 𝗪𝗪𝗪𝗪𝗪𝗪🗪 is Dr. 𝗓𝗨𝗪𝗪𝗪𝗪𝗪🗪, who holds multiple titles at the University of Miami, including Chair Emeritus of the Department of Public Health and Sciences, Director of the Chair for Family Studies, and Honorary Funding Director of the Miami Clinical Translation Science Institute. He also was the founder of a World Health Organization Center on Mental Health and Substance Abuse at the University of Miami, and has been a consultant to the UN and the Organization of American States in Latin America. Jorge and Jose, thank you so much for being here. I give the stage over to you. Thank you.
Thank you, Victoria. So I just want to say that it's an honor for me to be with my current boss, Michael Weinstein, and my former boss, Julio Frank, when he was Minister of Health of Mexico. So now the two of them are my bosses again. But mainly I want to just give the floor to Michael Weinstein, the President and CEO of AIDS Healthcare Foundation, so he can give us a welcoming message. And then after Michael, I'll do the same with Dr. Julio Frank. Michael, the floor is yours.
Good morning, good evening, wherever you happen to be in the world. First of all, I want to say that sitting here in Los Angeles, we are still suffering the devastation, both economically and socially, the hotspot of COVID-19. Say also that this is a really a dream come true for us at AHF. We've been talking about convening such a body regarding global health convention for 6 years now. And we really appreciate the partnership we have with the University of Miami. I'd like to give special acknowledgement to President Frank for having embraced this initiative and making his time available so generously. I wanted to thank Professor Spoznik for spearheading this within the University of Miami institution, and especially want to thank Jorge 𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪🗪, who within our own AHF family has really been the spearhead for the effort around this global advocacy, which I think is so desperately needed right at this moment.
Michael, very much, and I will give the floor right now to Dr. Julio Frank. They will have a chance later after the speakers, the panelists, to say something, comments, whatever they prefer to say. Dr. Frank?
Thank you, Jorge, and thank you, Michael. It's, again, an honor to be partnering with you. And for us at the University of Miami, it is truly an honor to welcome everyone to this panel of absolutely outstanding global health leaders as we are working together towards achieving the UN's Sustainable Development Goals and facing the threat posed by communicable diseases. The COVID-19 pandemic has put that threat into focus and reminded policymakers the world over that preventing and controlling infectious diseases must be a top priority if we are to advance global security, inclusive prosperity, and the universal exercise of human rights. Now, as the pandemic has evolved, it has become increasingly evident that global crisis can only be addressed through global responses, that isolationist and zero-sum mindsets do not work in an interconnected world. When faced with a novel disease, we're all learning as we go. And therefore, even if one country's national response were flawless, what happens in other countries during a global pandemic will necessarily have an impact across borders by definition. These complex dynamics force us to take a critical look at our current global governance arrangements. Are they effective? Are they as effective and equitable as they should be to mobilize global collective action when humanity as a whole is faced with the complex coexistence of public health, economic, and social crisis? I think that the proposed convention that will be discussed today can become a critical instrument to advance this vital agenda. Thank you all for your contributions to drive action and necessary reform.
Thank you very much, Dr. Frank. I'm going to start by saying some words initially, and then I will introduce all the panelists. So why we need a public health convention for the 21st century? Well, we know WHO was created after World War II, and it has had some achievements in the past, especially on eradication or close to eradications of several communicable diseases. And this doesn't mean that we need a new WHO every century, but probably just an update of the institutions dealing with global health. What is going to be mentioned here that might sound as criticism is definitely not related on any means to recent political considerations or decisions to undermine or defund WHO. This needs to be seen as continuation of concerns related with global public health governance in response to global health emergencies of international concern from the recent past, especially the ones related linked to Ebola. There were several panels in the past, and some of us have been participating on those panels. So several recommendations have been also taken from the past. So the preparation of the Global Public Health Convention proposal started to be prepared since last year, much before we knew about the current pandemic. Therefore, what we are seeing as failures or weaknesses on the global response to COVID-19 are probably not surprisingly new, but a consequence of global public health not being a global priority. I would say, like in the case of, for example, sanctions. Let's see, air traffic, international air traffic control. If the international air traffic regulations are not observed by a country, by an airport, or by an airlines, they immediately are sanctioned by not allowing them to fly anymore until they reestablish procedures accordingly. On trade and world trade, if countries do not comply with international trade rules, they can be sued. And international trade panels are established by the World Trade Organization, and countries are subject to trade sanctions. These sanctions have applied in the past even to the most powerful countries, including the US and China. International financial transactions, that is another section that has some international kind of regulations. If banks or bank account owners do not comply with some basic international transactions and requirements, then bank accounts can be blocked, sometimes confiscated, and banks can be sanctioned. And it has happened in the recent past, independently of the nationality of the bank. They are obligated to follow. Case of nuclear energy, again, countries need to follow international regulations and are subject to international inspections to assure compliance. If they don't obey to these international regulations on nuclear energy, they are also subject to sanctions. The UN Security Council meets in order to force countries to observe those regulations, and sometimes they agree to sanction some of those countries. But in the case of international health regulations, well, there are no sanctions. It's just a matter of health diplomacy and goodwill of governments. So they can just ignore the international health regulations and not much will happen. Let's see now on incentives, for example. Both the World Bank and also the Global Fund to fight AIDS, tuberculosis, and malaria provide funding to countries only if they follow some rules and provide sufficient data that the World Bank and the Global Fund require on a yearly basis and agree to be subject to international monitoring and audits. And they agree because they receive this funding, and it's like an incentive. The visits from the World Bank and the Global Fund to countries are not diplomacy visits of goodwill, but supervision of compliance. In the case of WHO, they don't have enough resources to provide incentives, and that's not exactly their mission. But in the case of funding, for example, on sustainable funding, let's see, the World Bank, how it gets its funding. Well, the World Bank gets it from fees paid by the member countries and also from funds raised at the financial markets, from earnings and investments, and from contributions made by members, particularly the wealthy ones, and from borrowing countries themselves when they pay back their loans. So in order to be members of the World Bank or the IMF, countries are obligated to pay quotas and pay back loans or interest of the loans. On the other hand, in the case of WHO, the funding of WHO comes 80% of it from voluntary contributions. That means goodwill contributions from donors, and they do have their own specificities and their own priorities, and WHO needs to follow that priorities. Less than 20% of the WHO funding comes from assessed contributions, and that's a percentage of the country's gross domestic product, but the members are paying like less than 20% of the WHO budget. The total yearly budget of WHO is less than several hospitals in the US. I mean, I think 100 hospitals in the US have a bigger budget than WHO. And on the other hand, the assessed contributions to WHO this year, according to 2020 this year invoices, are $247 million. So that's the funding of WHO at the current level. So on the later, we will see the recommendations that we are doing. Not all address specifically on how, but on exactly what to do. But many of the challenges are covered by these results. So I'm going to share now my screen to show you some. Let me see. Am I sharing the screen? Can you see my screen? Well, I cannot hear you, but I don't know.
No, we cannot see your screen, no.
No? Okay, so I already clicked it on share my screen. Okay, I think I got it now. Can you see my screen now?
No, we cannot.
Victoria, Mish, can you help me on this? Because according to me, I'm sharing my screen right now.
Yes, I apologize, Jorge. At this time, it seems not possible to share the screen. However, but we will. Apologies for that. I think it's due to the user limit with that platform. But perhaps if a colleague could share to us, and we could try to find a way to present it a different way.
Okay, well, I'm just going to read everything in front of me. So in the case of methods that we use, we identify experts through literature review on global public health, and also we identify people from recommendations of experts. then we asked them to identify barriers in the current global public health system, describe the necessary components of a global health security framework, and characterize qualities of a governing agency or organization. The interviews were all recorded, and we're talking about 28 interviews, 28 different global public health experts. And the interviews were recorded, transcribed, and analyzed using qualitative content analysis. And experts gave input to several iterations of the recommendations. So on my screen, I was going to share with all of you the names of the experts and the pictures of the experts, but since I cannot share my screen, I'm gonna do it just verbally. We had
we are seeing your screen now.
Okay, great. So these are our experts. 𝗪𝗏 Bannatin from the Philippines, Stefano Bertozzi, he's from Italy and the US, and he's the head of the Berkeley School of Public Health in the United States. Daniel Bauch, he's the director of Public Health Rapid Support Team, and he's also at the London School of Hygiene and Tropical Medicine. We have Akua Asena Dansua, she's a former member of parliament, a regional chair of Western and Central Africa at the Unite Global Parliamentarians Network to End Infectious Diseases. She's also former ambassador of Ghana, and she was also Minister of Youth and Sports at the Ministry for Women and Children Affairs. She will be here, one of our speakers. We have also Dr. Carlos Del Rio from Emory University, Dr. Sandro Galea from the Boston School of Public Health. Of course, Dr. Julio Frank, who's here with us, is the president of the University of Miami and former Minister of Health of Mexico. We also have, as members of the panel, Larry Garrett, who's a Pulitzer Prize-winning science journalist and former senior fellow of the Global Health Council of Foreign Affairs from the United States. Lawrence Gustin, he's the university professor and founding O'Neill Chair in Global Health Law at Georgetown University. Unfortunately, last night he sent us an email. He's in an emergency room right now, so he won't be able to join us. We also had as one of the experts, Dr. Ashish Jha from the Harvard Global Health Institute. We also had Stephen Hoffman from York University. We have also Professor Maksut Kulsanov. He's professor and founder of Kazakhstan School of Public Health, former Deputy Minister of Health, and he's joining us and he will give some words later. Also, we have Kelly Lee from the University of Burnaby, Canada. Stephen Lewis, also the Deputy co-founder and co-director of AIDS-Free World. He's a very well-known activist on the HIV arena. He's from Toronto, Canada. We also have Ricardo Leighton. He will join us, and you will know him. He's the president of Unite, and he's also a parliamentarian from Portugal. We had Barry Parks, also from Global Health Lead of Postgraduate Medical Education, Program Director from the University of Toronto. We also had Esther Passaris. She's a member of parliament from Kenya. Gisela Scaglia, she sent us a recording participation, and she's a member of parliament from Argentina. Carl Reddy, also he's originally from South Africa, and he's right now at the Health Interventions Network in Atlanta, here in the United States. Dr. Jaime Sepúlveda, also from the University of California in San Francisco. We also had Cyrus Shepard from Prevent Epidemics Project Resolve to Save Lives initiative here in the United States. Also, Member of Parliament Primish Solanki from India. Also, Congresswoman Donna Shalala, who is from the United States. Then Barbara Stocking, who's the president of Murray Edwards College, University of Cambridge. She is with us, and she will give us a short presentation as well. She is former chief executive of Oxfam as well. And we also had Member of Parliament Andrew Ullmann from Germany, and Jose Zúñiga, who is president and trustee of the International Association of Providers of AIDS Care. And finally, but I mean, because this is from alphabetical order, Michael Weinstein, the founder and president of AIDS Healthcare Foundation, who is here with us. So in the case of our operational team that have been working with all the documents that we have and the information that we got is Dr. Shaposnik, who was already introduced, is also Jonathan Duff. He's a health policy analyst at the Congressional Research Service in Washington, D.C. We also have Kendra Moranci. He's a research assistant here at the Miller School of Medicine at the University of Miami. Jacob Batuki is an MPH, and he's a manager of research and data department at the Public Health Sciences here at the Miller School of Medicine at the University of Miami, and also Annie Liu, who probably some of you have been in contact with as panelist. He's a graduate student assistant, and he's on her MPH here at the University of Miami as well. So now I'm going to leave into Jose's side so he can present the findings and the recommendations after this long consultation and the way we made it happen. Right now, we are going to leave it right here. I mean, I'm going to leave it right here, and I give it the floor to Jose Shaposnik. Jose?
Would it be possible, Victoria, to put the slides in full show mode? And there you go. Excellent.
So yes, exactly.
Thank you very much. So I'm going to be presenting the actual recommendations that came, or I should say a summary of the recommendations that emerged from the expert matter subject consultation. These recommendations are their recommendations. They're not mine or Dr. Jorge Saavedra. They are the group's recommendations. And we're presenting them here because we are soliciting first your input. We would like to get the input of the members of Unite. You all have a tremendous amount of experience, a wealth of knowledge about your countries and what would make sense from the perspective of your country's view of the international issues. And we also hope to have your support to these recommendations. So if we can go to recommendation 1. No, way down. Way down. Next. Go to slide 16. Next slide. So recommendation 1 is about the authority that a governing body such as WHO must have to be able to do its work. The first recommendation is that the governance structure for a global health security convention should grant the necessary authorities to a body to coordinate and direct initiatives in prevention, preparedness, and response globally. And this authority may include an agreed upon ability to compel countries and other relevant actors to act and collaborate. So it's important to recognize that today, the WHO is a consultative body and a technical advisory body. The WHO does not have the authority to coordinate or direct efforts in prevention, preparedness, and response of outbreaks, of emergencies of international concern, or pandemics. And so there is a mismatch between the expectations we have of WHO, which we expected to do something about preventing, preparing, and responding to a pandemic, and the fact that WHO doesn't have that authority. That authority rests with its governing body, the World Health Assembly, which is comprised of over 190 countries. And they, of course, are too large and too unwieldy to be able to effectively manage an epidemic or a pandemic. Next slide, please. Recommendation number 2 is the ability to respond. The global health security system or body, such as WHO, should possess the capability to flexibly and rapidly respond, instill protections, and issue resources for a range of possible public health security threats and scenarios. So in the title, I underlined and put in parentheses the word executive, because what is needed in the world is a global health security system or body, such as WHO, that has executive abilities. And the current WHO has not been provided with the authority or the mandate to have executive abilities by its governing body, the World Health Assembly. So we are recommending that if we're going to control pandemics in the future or prevent them, we must have an executive body. If it's WHO, then WHO must have delegated to it executive abilities. Next, recommendation 3, technical expertise. A global health security system, one body, such as WHO might be now, should exist as a singular authoritative source of information, data, and technical assistance. This body should possess technical expertise and must be able to communicate a clear and compelling message to the world. Actually, WHO is such a body right now, and they do have they are the singular authoritative source of information, data, and technical assistance. Unfortunately, they're not well funded enough to do all that they need to do in this area, but they certainly have the technical expertise and are recognized as the single technical body in the world. Next, please. Recommendations 4 and 9 are related, and I've placed them together, and they are about appropriate representation and multisectorality. A governance structure must be representative of all countries. Today, WHO has a World Health Assembly as its governance structure that is representative of all countries, but there are over 190 countries, and that is in terms of this recommendation, the experts believe that's unwieldy, and it's not possible for such a large governing body to be effective. And so the recommendation is for a smaller governing structure, perhaps with representatives elected from each of the regions of the world. The second aspect of representation in a governing body is recommendation 9, which suggests that a governance structure must involve multiple sectors at all levels of governance and action. In addition to national governments, as occurred now with WHO, these may include private sector, local governments, and civil society. And local governments may seem like an unusual recommendation, but I want to point out that a lot of the actual public health work that goes on around the world is carried out by local governments. And when countries, states, sign into international agreements, they do not always have the support of local governments. So in a new public health convention, we have to work towards some aspect of inclusion of local governments in the commitment to do what it takes to prevent, prepare, and respond to pandemics. Recommendation 5, evaluation and remediation. Built into a governing framework for global health security should be the capacity to objectively and externally evaluate countries on their progress in achieving requirements and the ability of that governing framework to require that remediation and possibly the ability to coordinate remediation for identified deficiencies in specific countries. That's very different from what exists now. What exists now is the joint, it's called the joint external evaluations, and the joint external evaluations in WHO, or as part of the, I should say, of the international health regulations, are purely self-evaluations, and said there is really no objectivity or limited objectivity to them. And so the recommendation here is that there should be evaluations that are objective and are fully conducted by data that's collected in the country by an external body to that country. Next, recommendation 6, enforcement mechanisms. Reform must equip a governing body with enforcement mechanisms. This may include incentives for countries to cooperate or sanctions for non-compliance. Dr. Jorge Saavedra spoke about the many international bodies, such as the World Trade Organization, that have mechanisms for incentives and sanctions. I guess in the past we consider health not to be as critical, and so we allowed for there to be a total voluntary system of complying with the international health regulations that set the standards for preparedness and response to pandemics. And we all recognize now that that's insufficient, that there must be a mechanism for incentives and sanctions for non-compliance. Otherwise, we are not going to get the kind of international collaboration that's required to prevent epidemics from becoming pandemics and jumping from country to country. As you know, the old saying goes, pandemics don't recognize international borders. Recommendations 7 and 8. Next, autonomy, the need for autonomy and independent and sustainable funding. A governing body such as the WHO must be able to make autonomous decisions, meaning that their decision-making process is free from political pressures. And to this group, free from political pressures, to large, not entirely, but a very important part of it is funding. As Dr. Jorge Saavedra indicated, 80% of the funding of WHO today is voluntary. It's provided by large donors, not for the main mission of WHO, but for what some may call pet projects of each donor country. And for an organization that's going to look after global public health to be autonomous and for its decision-making processes to be free from political pressures, it must have a sustainable financing system that protects that governing body from political pressures or influence or the threat of inconsistent funding. They have to be able to make decisions. They have to be able to call upon countries that are not doing what they should be doing to prevent a pandemic, whether those countries are large and have the potential to be large donors to the organization or not. So sustainable financing in the form of philanthropic endowment, long-term endowment, in the form of committed resources from each of the countries, or even in the form of taxes to international transactions, are essential if we are going to ever have a global public health organization that's going to function the way we all would like it to function, without regard to, without concern, I should say, for calling large donor countries when they do not do what they should be doing to prevent the spread of pandemics. And finally, recommendation 10 is, it's not only about the global public health organization that's going to direct and coordinate these activities, but it's also about the responsibilities of every stakeholder, particularly the nation states, the countries that are part of the governance of WHO and that benefit from the prevention, preparedness, and effective response to pandemics. For a global health security system to be effective, individual countries must acknowledge and fulfill their own responsibility in contributing to effective global prevention, preparedness, and response efforts of outbreaks, of emergencies of international concern, and of pandemics. And they must cede some authority to a global governing body to permit that global body to effectively coordinate and intervene to prepare, and respond. Thank you. I hope that to receive many of your suggestions and recommendations for these of what you would like to see in this report when it comes out later this year. And definitely we seek your support. And with that, I turn it back to Jorge Saavedra.
Thank you, Jose, Dr. 𝗪𝗪𝗧. So I will now like to give the floor to then Commander of the British Empire, President of World Edward College at the University of Cambridge, Barbara Stocking, who's also former Chief Executive of Oxfam, and she was also the head of the chair of the panel that a few years ago convened in order to evaluate the WHO response to the Ebola crisis in West Africa. So it's my honor right now to leave the floor to Dame Barbara Stocking. Barbara?
Yes, thank you very much. It's a privilege to be able to put to you some of the findings and thinking of that Ebola work in 2015. The panel that I chaired really looked at three aspects of what was taking place with Ebola at that time. One was WHO's effectiveness, and by that we meant very much both the Secretariat and the member states, not just putting it all onto the Secretariat. The second part was about the international health regulations, and the third part was WHO's relationship with the rest of the humanitarian system. And that third part I'm not going to talk any further about now. Now, WHO itself, we all knew that there were very serious issues about its inability to have any sort of continuing program of preparedness and response to pandemics. And what it needed was a properly funded health emergencies program. Now, what we have in WHO now is a health emergencies program, but it clearly will need further strengthening because, as has been mentioned, so much of WHO's funding is not core funding, and that's true of the health emergencies program as well. We also noted very strongly that WHO had to move, had to have a culture that could move quickly from a norms and standards provider, if you like, to a serious emergency response. Now, I mean, I don't know how far WHO in those internal matters has moved with COVID, but I do know that there have been significant changes with the health emergency program, with the now over $100 million contingency fund for pandemics, significant progress on the analytics and actually external communication, in fact, this time, and a much greater readiness now to take the political risk of calling a public health emergency of international concern. But as we know, and we've been talking already, there's a significant gap between WHO's effectiveness now and what you would really call a successful control of global pandemics. Now that brings me to the international health regulations, which describe the core competencies of each country for preparedness and response. And there is still a huge amount of work to be done here. And a lot of it cannot be funded by the countries that need to put those systems in place. And there will be a need for much greater funding still to bring those core competencies in place. But as has been said, the absolutely central issue is that while states have signed up to these international health regulations, WHO has never been given the mandate to monitor countries in depth or independently, and nor do they have either an inspectorate function nor a sanctions process, as we've already discussed. The fundamental issue, as I see it, is that health is considered a sovereign responsibility of countries, and countries are not readily accepting either criticism, sanctions, or even thorough inspection. And yet, as we all know very strongly, the global pandemics operate globally, and we have to collaborate and work globally if we are going to get control of prevention and response. In 2015, our panel raised many of these concerns, not quite as deeply and thoughtfully as we now have them under the recommendations that have just been put out. But what happened in 2015 is that as the Ebola outbreak and pandemic was contained, all the interest and impetus for change actually disappeared once again, much to many of our sadness, because actually, of course, we now have the COVID situation. But the final point I'd just like to make briefly is one that is in the recommendations, but I think needs to be brought out more strongly. And this is about prevention, because there is a whole set of issues around how we're going to have to work cooperatively on the prevention of these pandemics. And in particular, all the work that we know needs to be done about issues around animal to human transmission of particularly viruses, which we know exist in huge numbers, hundreds of thousands, millions already. And whatever we do in terms of bringing us all together globally under whatever UN convention or anything else, that side of that work is going to have to really take off much more dramatically. Again, both in research, but also in how we actually work together to control matters right at that prevention level. So those are a few quick comments from me, and I hope these are helpful in giving a bit of backdrop to, sadly, the situation which repeatedly happens, which we have a pandemic, we make some progress, but it often slips back, but we are simply not getting to grips with global pandemics as we need to today. Thank you very much.
Well, thank you very much, Barbara. And now we are going to jump to Professor and founder of the Kazakhstan School of Public Health and former Deputy Minister of Health, Professor Matsuka Kulsan. Matsuk, the floor is yours.
Thank you. Dear colleagues, dear ladies and gentlemen, good morning, good afternoon, good evening, and good night. A new coronavirus infection has rapidly burst into our usual life and significantly influenced to each of us preparing public health in the world. A lot of information has been provided in the report developed and presented today. I'd like to share the experience of the governance model of the Global Fund to fight HIV/AIDS, TB, and malaria, since I am convinced it's a good model where other international organizations, including WHO, can learn from. Before I will start, I would like to pay your attention that the Global Fund was created 20 years ago as an innovative financing mechanism that seeks to rapidly raise and disburse funding for programs that reduce the impact of HIV/AIDS, tuberculosis, and malaria in low and middle-income countries. The Global Fund is structured as a partnership between developing countries, the private sectors, private foundations, civil society, and affected communities. The Global Fund has established a unique architecture under which program proposed, selected, managed, and implemented at country and headquarter levels. Principles of Global Fund are aimed at rapidly responding to 3 diseases. The focus, as mentioned, is on improving and aid delivery systems in low and middle-income countries. The fund was designed to incorporate the benefits from the expertise of broader and diverse set of actors and entities than traditional programs. And those includes civil society and the private sectors and the board, with voice and vote, and also in the implementation of programs in recipient countries. In the initial negotiations, people realized multiple mechanisms would be required to move funding quickly to countries and communities. Unlike many other donors, the Global Fund has adopted a model that provides funding to country governments and in-country stakeholders based solely on proposals and implementation plans designed by countries themselves. As a result of its new approach and its ability to raise funds, the Global Fund has rapidly become one of most significant aid mechanisms. The Global Fund is governed by a board who is responsible for providing guidance to Secretariat, endorsing all policy and strategic decisions, and approving all grant funding decisions. The Global Fund board consists of 20 representatives of donor and recipient governments, non-governmental organizations, the private sector, business and foundations, and communities affected by diseases. Therefore, the Global Fund board is a small governance body that represents all regions and eligible countries all over the world. On other words, not all countries represented need to be sitting there, but all of them represented through constituency network, and they rotate on a regular basis. World Bank, UNAIDS, and the WHO also participate as non-voting members. Important that the Global Fund does not prescribe or recommend any specific programs. Countries are encouraged to write cost-effective and practical national plans from which the proposals should be drawn. Global Fund board activity could be one of the examples of good governance, partnership relations between government and non-government bodies, civil society, community, and international partners in health policy development. And this also reflects in transparency every time there is an assessment of global agencies dealing with different aspects of development. The Global Fund always ranks the top most transparent organizations in the world. Finally, I would like to say that there has been a long time discussions at the Global Fund board in terms if the Global Fund should expand its mandate. I believe that due to its successful model, Global Fund is the best prepared agency to the financial mechanisms that can incentivize prevention, preparedness, and response to the potential pandemics at the country level, mainly in developing countries. Such a mechanism does not exist right now for infectious disease other than HIV/AIDS, TB, malaria. Thank you very much for your attention.
It's my distinct pleasure to introduce next Ambassador 𝗂𝗂𝗂𝗂𝗂𝗂. The ambassador is the regional chair of Western and Central Africa for UNITE. She's former ambassador to Belgium, she was former member of parliament in Ghana, And in Ghana, she was the Minister for Tourism. She was also Minister for Youth and Sports. And another point, she was the Minister for Women and Children's Affairs. Well, welcome.
Thank you very much, Jose. And before I proceed, let me say that this presentation should be seen as a further summary of the elaborate presentation that you did on the work of the group. And now let me use the opportunity to express my personal and the group's appreciation to the President of Unite, Dr. Ricardo, and the entire network for the opportunity to do this summary on behalf of the group. We, as Jose said, we are a diverse group of experts, comprised of academicians, medical doctors, public health, governance, leadership, and media practitioners, civil society organizations, and politicians, among others, who seek to build on previous global response to infectious diseases such as Ebola in West Africa, and also lessons learned from the SARS, MERS, and Zika in other parts of the world, and to further request for new guidelines preventing, preparing, containing, and ending infectious disease outbreaks, and also protecting the global community in the 21st century. Much as we hate pandemics and do not wish for them, there is abundant scientific evidence that pandemics are part and parcel of our lives and humanity, and will strike frequently with very devastating consequences. It's been scientifically proven that COVID in particular is very different in its genetic composition and is also highly infectious. The WHO dashboard, as of today, I mean, not that everybody can check it, on the details of confirmed cases, new cases, and mortalities. Our group, having focused on and followed the devastation and disruptions that COVID-19 has caused and continues to cause to our lives, health systems, businesses, careers, family lives, among others, is of the view that many of these infections and deaths could have been prevented had the world and our leaders responded appropriately at the onset of the pandemic in January. Our group is advocating for a new 21st century global health convention, which is strong and enforceable, that will compel urgent, joint, and effective global action to handle pandemics when they break out. I think Jose and we have already spoken to that. And we observed that the WHO's 2005 International Health Regulation, which urged international collaboration with its members to prevent, protect against, control, and provide a global health response to the international spread of health, needs to be strengthened to achieve the desired impact in global pandemic management. In its current state, the IHR is enforceable on members already had, and is unable to elicit the kind of and urgent action required to manage pandemics as evident since the outbreak of COVID-19 in January. The group also makes an equally strong point that the new convention should be free from institutional and individual manipulation or control. It must have adequate and substantial sustainable funding and be inclusively owned by stakeholders, including medical doctors, academicians, researchers, the private sector, the youth, women, men, old people, the aviation industry representatives, travel and tourism sector representatives, sports, pharmaceuticals, and any other identifiable stakeholders that are likely to be impacted by any pandemic. Presently, when we think about global pandemics, immediately our attention is drawn to medical doctors, researchers, academicians. But we are saying that pandemic infections affect a multi-sectoral number of stakeholders. And so we must identify these stakeholders and have their representatives on this new Global Public Health Convention that we are advocating for. Our group is therefore at this summit to canvass for your strong support as current and former parliamentarians, as senators, as UN and its working agencies such as the WHO, UNDP, UN Women, UNCTAD, world political leaders, men and women, the private sector, civil society organizations, such as the C20 group, as well as the media, for this new Global Public Health Convention for the 21st century, which when crafted will complement the WHO's IHR and the UN SDGs, among others, to better manage future pandemics. We equally call for support from regional groupings such as the European Union, the African Union, the South Asian Association for Regional Cooperation, SAC, the Organization of American States, OAS, the Association of Southeastern Asian Nations, ASEAN, the Pacific Island Forum, PIF, and any other identifiable groups to support this noble cause. We are saying that we are in this together and we have to act together to solve the problem. Thank you very much. And my colleagues will also assist in responding to any questions that may come up. Thank you so much.
Introduce Dr. Aminata Touré. Dr. Aminata Touré is the former Prime Minister of Senegal. She has a PhD in International Business Administration and Finance. She's also a former Minister of Justice, and she's currently the President of the Economic, Social, and Environmental Council of Senegal. Dr. Touré. Dr. Touré, we cannot hear you.
Thank you very much. I think now you do.
Yes, thank you.
Okay, I was saying that I'm delighted to be part of this conversation, a very important one. And I would like to start by stating and reminding to all of us, we do know that, but I think it should be restated in this context of international health crisis, that the right to health is a human universal right. So the word universal is key in this sentence, which means that all countries who signed the Declaration of Human Rights must live up to that responsibility. So this is, according to what they have signed, a moral and even a legal issue to make sure that they would enforce this right to health in their own country and, as part of the international community. I think from this discussion, we are all in agreement that the global health system must rely on common responsibility, on shared responsibility, on accountability, and of course, we have to rely on the trust in our institution that we chose for ourselves. In the context of COVID, we do think globally that prevention, and it has been stated by different interveners, that prevention needs to be, one of the endeavor that we have to carry, because we tend to think about the curative action, but prevention is so important to build into our global collaboration system. It's important also to remind ourselves that the states, in order to improve the public health and the economic consequences, must rely on international cooperation, being wealthy countries or developing countries. It's very important also that we see that we are equal in exercising our responsibility. from the discussion, it arises that, you know, many people believe that member state must sort of delegate part of the authority to WHO, that in order for it to have an executive mission, and that would prepare WHO to be more effective. I like to express, I would not say a disagreement. I mean, I would turn down a little bit that, because I used to be an executive person as prime minister. First of all, let's remind that Africa is a little bit upset about WHO as we speak. Hope, you know, luckily we didn't see the million of deaths that were announced, which question a little bit, you know, how, you know, what's the link between such a global organization and the knowledge of the situation in the countries that are part of the organization. As a matter of fact, it's important to remind people that Africa is the less, for the time being, and we cross fingers, impacted continent by COVID-19 for different reasons. Not only because our population is young, 70% of African people are below 35, but actually I think that's also because we piggybacked on our experience on pandemics, and many governments took quick actions. As a matter of fact, I was reading an article in one of the US newspapers, sort of praising the intervention of Senegal. As a matter of fact, we took very early action in terms of, you know, border control, in terms of, you know, creating, sort of taking the measures to limit gathering and making masks available. All of that because we reacted quite quickly. So that has to be also acknowledged as part of the lesson chair to be chaired within the international community. One question that is key is, who is responsible for the health of the people? Well, according to the people, it's the people they have elected for that. So it's going to be quite complicated to transfer such a legitimacy to a global body that sometimes was not that effective in responding to, you know, the health issues of the countries. Yet, I'm a big supporter in increasing the needs and the fundings of WHO. Yes, 70 to 80% of WHO funding is voluntary funding. I think that needs to be changed. I think people, I mean, the countries should be more accountable in terms of contribution, and as I say, they have to live up to their responsibility. So I see WHO myself as a collaborative global institution, more than an executive body, because transferring sovereignty from the states to a global body, from an African standpoint, it has not been always a success, let's say. So it is going to be very difficult within the African community to advocate for that at the state level. Yet, I think we can have a sort of half-half, we can meet at halfway by strengthening the means and the finance, and of course, supporting and strengthening the technical expertise, and making sure, because I think for me, that's the role of WHO, is to support countries for them to develop their health sovereignty, because that's what we have seen during the pandemics, that countries have to rely on their resources, on their system, on their knowledge, and that has to be supported by WHO very strongly, rather than delegating, I mean, those actions that are at the core of the legitimacy they got from the people through elections. So I think that is something that we have to look at very, very, very carefully. But of course, pandemics, you know, they don't know about borders, they don't know about color of the flags, the individual flags. and then the response has to be also global. It has to be, as development activists say, the local meeting the global, but not the local transferring its responsibility to the global. That's how I look at it, and it's very important from a political point of view. If you want to make progress, that we look into that. The World Health Assembly, made of the states, do have the ability and the legitimacy to set up the norms for WHO. The Secretariat is at the is supporting that global assembly. That's how the UN system works. If you want to set up something different from the UN system, that's another story. But it's going to be very difficult, as I said, to transfer responsibility that are at the core of the sovereignty of countries to WHO. Yet, again, so I like to make it very clear, WHO needs to have more resources, more expertise, and should be much more supportive to countries to help them be resilient, strengthening their health system in order to be able to respond to health crisis. And of course, it has to be a convening body by which different state members will discuss and take decisions. So that's how I look at it. I'm slightly, I'm expressing a different point of view, but building on both my experience from the UN system, because I spent 25 years in the UN system, and being also part of a government for many years. So that's what I would like to say. But this is, a very good start on how are we going to put our minds together to make sure that we do have, as I said, the local and the global not contradicting themselves, but strengthening each other. That's why the discussion also has to be on how are we making sure that countries have good health system, and health system that don't segregate, because even in very advanced countries economically, we do have large numbers and cohorts of people who are segregated when it comes to discriminated, the best word, when it comes to access to health. That's, I can openly speak about the US because the statistics are there. We have seen how vulnerable, ethnic minorities have been more impacted by COVID. So that also is something we have to look at, how the global really address the issues as human rights issues and link up to the global, and see how we can share knowledge, how we make sure also that research and the result of research will be democratically shared on the basis that we all are responsible for enforcing and realizing human rights as one human community. Thank you.
Jorge?
Yes, I think we have a pre-recorded message from Congresswoman Gisela from Argentina. She can.
Buenos días from Argentina. I'm Gisela Scaglia from Argentina. I'm Congresswoman and Unite Chair from Latin America and Caribbean. I'm sure you will agree that being reunited to discuss recommendations around global public health is nowadays more important than ever. I would like to thank the great team from University of Miami. They adopted what, in my opinion, is the most interesting perspective. They were able to see this pandemic-related crisis as an opportunity to reflect upon our future, an opportunity to exchange ideas, an opportunity to think about the pros and cons of the health global organizations as we know them in the present. I would like to stress the importance of the report. It allows us to fully acknowledge the present situation, and what is more important, it offers us guidance and recommendations on how the process of compelling nations to engage in pandemic prevention effort could move forward. The recommendations within the report strongly and correctly emphasize on operational reforms ensuring adequate global pandemic preventions, preparedness, and response. We have a really serious problem if the countries do not follow international health regulations and standards, but a more serious problem if those regulations cannot be enforced. It is a great time to reflect upon new rules and upon which is the international systems we want to build or rebuild, and which functions that systems must have. It is absolutely necessary to put in the global agenda global health and pandemic-related issues. The COVID-19 pandemic scenario has created a good framework to discuss and make decisions about our future. The supranational organizations have a big role to play. I believe that the WHO organization should carry out an internal debate, and the countries should do the same. The leading countries must have deep conversations in order to improve global health, knowing the difference among the countries. In the report, we correctly find recommendations about enforcements and mechanisms, and may include incentives for participations or penalties for not compliance. I go further and propose that incentives should be associated with opportunities and alliance among countries. I think we always have to stress the importance of research and development. When rethinking the role of supranational health organizations, we have to pay attention to the fact that sometimes have international organizations with a lack of territorial agents, that is, personnel capable of being fully aware of the political and economical situation of the country they are working in. Agents who could be able to offer a non-politicized point of view. It is a huge effort to rethink the role of supranational organisms, but it's now more necessary than ever. Let's make the task we have ahead worthy. Thank you.
Thank you, Gisela. I think we have another pre-recorded message from Ricardo Late, and I hope to have a little bit of time for questions and discussions at the end. Sorry, we forgot to mention that former Prime Minister Aminata Touré is also a member of the Club Madrid group of former prime ministers and presidents who join efforts in order to address development issues and many of the international concern issues. Thank you, Prime Minister Touré, former Prime Minister Touré. So we have this pre-recorded message from Ricardo.
We are very honored here at the Unite Global Parliamentarians Network to End Infectious Diseases to join efforts with the AIDS Healthcare Foundation and the University of Miami in discussing what needs to be a global public health convention. This is an important initiative. It was before the pandemic. It is even more now that we are dealing with COVID-19, because COVID-19 has put a magnifying glass on the cracks within our systems, within our national health systems, but also in terms of the problems and the frailties of our global world order. It is clear to us today that we should have been better prepared, that we should have been capable to respond more effectively to the challenges and threats of a biological agent, as the case of SARS-CoV-2. So what can we do better in the future? Of course, we need very strong regulation and policy frameworks. This convention will create that mapping for policymakers and governments and institutions around the world to work better together. But we also need to learn on how to use our resources more effectively. We have seen in the past, following World War II, that the world understood the economic and social perils of war and how the negative consequences of war should be avoided at all costs. And in the North Atlantic, we created NATO, the North Atlantic Treaty Organization, precisely to respond to that, which is basically an organization that is focused on using military resources from each country, but in a coordinated fashion. So thinking of this and adapting it to global health, we need to make sure that each country has its own mechanisms and reserves capable to simulate and work together constantly and having action plans, and also being prepared to react in the case of another threat, such as the pandemic we are living, but also to make sure that we are capable to prevent these kind of situations and to contain them as soon as possible. We need a very strong diplomatic organization. WHO, in a way, can play that role. We need to make sure that we have technical bodies that give us the advice, and that should also come from WHO. But what we have learned from NATO is that we also need to learn from lessons from those simulations, from those germ games, if you will, and also from real world situations like this pandemic. But we also need to make sure that we have operatives capable of intervening on the ground. Together, we can prevent further pandemics. If we use all our resources in an intelligent and coordinated way, we will be able to end infectious disease as a global health threat. It's time to unite. Thank you.
Thank you very much, Ricardo. I think we have just around 10 minutes for comments and questions. And I think there is a question from the social media. And I don't know, I don't know if Michael or Julio Frank would like to address this question. And it says, what reforms we should make now and which ones we should look at a post-pandemic era? How can we achieve comprehensive public health convention by leaving no one behind? So which ones now and which ones to leave it to post-pandemic situation, in case you want to address it.
I'll just say, if I could just speak briefly, I think what we've learned and what Barbara Stocking talked about is, while it may seem logical to wait until after pandemic subsides to address these kind of structural issues, once these pandemics subside, the interest evaporates. So I think right now is exactly the right moment to talk about total structural change. Otherwise, we will lose that moment and we'll lose the energy to make the change. People will forget how the disorganization, both on the prevention end and the response end, led to this catastrophe. So I think now is exactly the right moment to be talking about the big picture and the long view, not just the technical matters.
Okay. Julio, you wanted to say something?
Sure. The question, a little bit, given the time, almost like some closing comments, but the question is very good. I completely agree with Michael. This is the time to act. There is something in our favor this time around, contrary to what happened with Ebola, as Barbara was very eloquently describing. The extent of economic damage created by this pandemic has no precedent. And I think it has woken up decision makers outside of the health arena to the need for a better permanent solution that doesn't catch us the next time around as unprepared as it did this time. I think that's the opportunity now, because with a fraction of what's been lost in capital markets or the damage that's been done to national economies, we could fund many times over a sustained effort, both on the response, the prevention response, but also on the scientific side of having better tools for testing, for treating, and for eventually immunizing people in a much shorter window. So that's the big opportunity. The big threat right now is that as we're talking, in countries around the world, the pandemic has given rise to a reaffirmation of the nationalistic, isolationist discourse. The idea that the best way to deal with this is to, keep the others outside. And, the US withdrawal from WHO is a symptom of a much larger movement. So we need to also start acting now, because the rise of anti-globalism has gotten, paradoxically, a new wind out of this crisis. It has fueled that discourse, and it's happening in many, many countries. So I do think we need to be very, very vigilant. In my mind, both the report that you have done, Jorge and Jose, and with all the expertise you interviewed, plus the discussion today, which I think has been very rich, gives us a very clear sense of what the general direction. I think we need to make sure that political actors beyond the global health community get engaged. And one recent development that I find very encouraging is the recent launch of the independent panel that was just announced. It's called the Independent Panel for Pandemic Preparedness and Response, which has a number of heads of state, heads of government, a very, very high level panel. And I think, co-chaired by President Ellen Johnson Sirleaf and former Prime Minister Helen Clark, and then a number of former heads of state and other very high-level people, not from the usual suspects of the global health community. I think we need to leverage this initiative. I think part of their mandate is exactly to have this broad look into this crisis. The last thing I'll say, I really agree with a lot of the sentiment in both the report and what's been said today. I don't think the kind of incremental change that we've seen after previous pandemics, the kind of review that the international health regulations mandates, is going to suffice. I think this really requires a systemic view, a redesign, to think more as a system rather than an agency, although I do think that WHO needs to be preserved and strengthened. But as Ricardo later was just echoing, there are a number of pieces and some models from other arenas. He mentioned NATO, but there are others, because as the report clearly has stressed, we have pieces in place, technical expertise for sure, the incentives, the previous comment from our colleague from Kazakhstan about using the global fund. But the crucial missing pieces is a rapid response force, and particularly crucial missing piece is an enforcement mechanism that has credible sanctions at its disposal. And those, I think, require the leadership of the UN now in its 75th anniversary, seeking to reinvent itself, of the World Bank, and of the type of leadership we've seen in this independent panel. I think that's what's going to take us to the next stage. But I do agree we cannot wait until the pandemic is over. Every country is doing its best. Hopefully there'll be a vaccine in the horizon. But the action has to start right now, because the next pandemic is just waiting to happen. And if it catches us as unprepared as it did this time, I am not sure the world will.
Thank you very much, Julio. I think Barbara mentioned that she wanted to say something at the end during her presentation. Barbara?
No, I just wanted to say that, in fact, I think one of the central issues in this is exactly what Her Excellency Madame Touré said, which is how do we maintain strength and ability of all the local systems to work and not take power away from them, but yet at the same time getting much better at working globally. And where is this balance between cooperation, which we'd all love to have anyway, but actually moving to that big question of things like sanctions and inspection and so on. And I think one of the biggest parts of the discussion that has to take place now is a political one about how far we can move the world to that more cooperative state. And whether, in fact, at the moment, whether people would just absolutely reject more of inspection and sanctions and so on. So, I mean, I think, Arto, if I say so, I think you absolutely put your finger right on the issue. We want to get the states working themselves internally, strengthening their health systems and so on. But what is it we can do at that global level that states, like yours, that want to do the right thing, are prepared to go along with to help the totality of the load.
Yes.
Minister Aminata Toure. Sorry.
Yes, I think what we can do is to share knowledge to begin with, to, of course, advocate for more resources. I was typing on that, saying that international solidarity must express itself directly to health system. Let's remember that it's the first, door of entry when you're sick of COVID or anything else. And most of the time, these health system, have to cope, alone within, the budget that is available, and that is most of the time largely insufficient. So I think advocating for more resources for health system within countries to begin with, within countries, maybe giving less to other sectors and more to the health system. I think this is something that should be put forward at the next WHO General Assembly. So countries take commitment to increase the percentage of resources or to live up to their commitment in terms of the part of budget, national budget, that should be allocated to the health system. Second, I think it's important, I said it, but maybe not strongly enough. It's part of making sure that discoveries and research results also will not only be left to countries that can afford to have them. And I'm hinting at vaccine, but for the very for now, making sure, for instance, that testing is available to countries is something that is going also to strengthen health systems. So in a nutshell, more resources, but it's from a policy point, but from an international advocacy point, sharing knowledge, making tests available, and strengthening the knowledge of the health system workers, and of course, protecting them. So that is something that would really help, because if you jump talking to the global, it doesn't speak very much to the actors that are very much at country level. And again, to come back to Senegal, we had to rely on our national health system. Everybody left. One of the first decision that was taken by many countries is to make their citizens go back home. So we rely exclusively on national health workers. So that is also something that we have to look at. So the global community has its own issues in terms of solidarity, strengthening the mechanism, supporting strongly WHO. But it will only be relevant if it has an echo at the national level through the different points I made.
Thank you very much, Prime Minister Aminata. And before closing, Michael just asked for a very brief comment. Michael?
Yep. One very elemental issue is, are we going to allow the beast, to ravage the world? I mean, there are many, many different aspects of health policy that must be addressed. But the reality is that this disease, was allowed to explode when it could have been contained. That it went for months and months before it was declared a pandemic. So the burden that's on countries around the world is so exacerbated by the fact that there was a cover-up to begin with, and that the mobilization around the world was so delayed. And I think that, again, we can talk about all the multifaceted aspects of health policy, which AHF is involved on a daily basis in 45 countries. But the essence of the accountability, the transparency, and the requirement for cooperation and for compliance has to remain at the essence of the conversation right now, or else we're doomed to repeat, these wild beasts, ravaging the world again.
Thank you, Michael. Jose, do you want to say the final closing remarks? Thank you very much from my side to all participants, to our panelists, and to the audience. Jose, I leave it to you.
I would like to thank all of the members of of our group that contributed to these recommendations. They've done a terrific job. I would like to thank Unite for hosting this panel, as well as AHF and the World Leadership Alliance, Club de Madrid, who's partnered with us in this initiative. Thank you, everyone, and Godspeed.
Thank you.
Thank you so much to all of the panelists, and a special thank you to AHF for launching this exciting and important initiative at the Unite Global Summit. So before we transition to the keynote statement by Dr. 𝗨𝗂𝗂𝗧𝗍𝗂, chaired by Unite's president, we will first take a very short break just to allow the transition onto the stage. So we will see you right back here. Thank you.